it's hard to underestimate that new stress that was layered on top that we were working on day in, day out, and we kind of didn't really talk about it a lot, but I think there were so many more layers of stress with shutting down services and some people not being able to come to work, other people having to come to work and do jobs that they weren't trained for or comfortable with, to the fact that we might not have enough ventilators, to what are we going to do if we don't have enough? We got to stand up an ethical commission. I mean, it's hard to describe that stress that we had never felt before on top of the normal stress of working in healthcare.
Yeah, that was so true, because every day there was anxiety related to the next bit of information we may be receiving, preparing, and being ready for what we believed was going to be our emergency department overrun with positive COVID cases. Under that stress, I know that myself and many of us at all levels of the organization were not only worried about our community and patients, but ourselves, our families, and then one another, the people that we work with. So there was a lot of stress that really created, an opportunity to recognize that. And I would say through the incident, we did have to acknowledge that there were times in which the team was stressed, tired, and to make sure people were taking care of themselves.
In this next segment, you're going to be hearing from some of the frontline workers that describe how they felt working under that stress.
How is our staff feeling? How are we going to support people? And that was the trigger for me from a planning perspective to say, hey, we got to stand up something for staff, because I know my experience right now is terrifying. I am not the only person who's feeling this, and we are asking people to put themselves at risk. It's a tremendous amount of work just to prepare for that first patient. How are we making sure that they're getting what they need to be successful? Childcare's closed, school's closed, all of those things became part of our objectives, even though they had nothing to do with the disease process itself.
We had to really change the way we practice medicine and change the way we deliver care to our patients. That's hard. That's hard, being faced with knowing that the only faces these patients saw were us. We were their family, behind a mask, behind a face shield, with a bouffant and gloves and gowns. So they only saw this. That's hard. It still remains hard.
The hardest part for me emotionally was just trying to figure out how to best support other employees, and seeing how sometimes they felt just really discouraged and frustrated, and trying to listen to their frustrations or their fears and anxieties, and to address them and feel like I'm not just listening, I'm actually doing something about it.
I didn't want to bring those shoes home, those clothes home, things like that. So when I got home, I basically go in my door, go down my stairs, straight into my basement. Everything just goes straight into the washer, so nothing enters the house proper, which was something I'd never done before in my years of healthcare. I had work shoes and home shoes, and my home shoes, because they had entered the hospital for a little bit, usually sat outside on our deck, so they didn't even come into the house. Just really thinking about all of those type of contaminations, because I do have a husband who has some of the comorbidities.
Probably my other real moment was every day when I went home and took off my scrubs in the garage, because I was like fearful that I was bringing something home. So it was rough. This is my new norm. Like, work bag hung outside, winter coat hung outside, shoes, I cleaned them, but these were my only shoes I would wear. Like, yeah, it was crazy.
It was my job to remain calm, to keep everyone else around me calm. That's something that the emergency department has been able to provide me with and season me to be able to do. when we're calm, our patients are calm. Our environment is calm. And that also helps to internally keep me calm.
There was a lot of discussion about, ventilators being the last ditch effort. And I was actually involved with one of the medical ethics groups that looked at the whole ventilator process and how you decide who goes on a ventilator. And we worked with a group of physicians from University of Vermont Medical Center, who were, including a medical ethicist, and other people that worked in critical care. And there were some physicians from other hospitals in the state also. And, that's a decision that no one wants to make. And then if you have a short supply of ventilators, who do you decide that needs to come off because someone else needs to go on?
I was very lucky in the sense that I had a former coworker in the laboratory who had done infection control, that she got deployed very early on to help support. Because that first couple weeks I was working 12 to 13 hour days, it was not going to be sustainable. The other thing was that she kind of taught me too was to recognize the small victories. There were sometimes it felt very overwhelming, but we had weekly updates that got sent out. And one of the things that was on the weekly updates was, how many NMC staff members had been infected through hospital-based transmissions. And every week that read 0, that was a huge victory for us.
I was very thankful to have had my first time. If it was going to be a worldwide pandemic, I was thankful for the people who I got to work with and support and who supported me. And that's, the lessons learned are the things that will make it better from this point forward. But, that really valuing those relationships is so important, whether you're inside the room or outside the room, because you need that, especially for something like this, which can take such an emotional toll. And, there were good days and bad days, but there was a lot of good laughter too, and a lot of moments that everybody was able to just breathe and allow ourselves to be human.